Stop it. Yes, please. Yeah. Okay. Hello. Let me just, hold on. Just hold your thought there. I'm just making sure that my latest Instagram post was alive. Saving lives and all that. Yep. We're good to go. Okay. Alright. Let me see. Who do we have here? And you are. Okay. Right. And why exactly are you here? Okay. Okay. Basically, you don't really know why either. No worries. Wow. Let me first of all introduce myself. I am Lauren. Pleasure to meet you. You can call me Dr. Murmurs, but I prefer Lauren. It's a little bit too formal, all that doctor nonsense. I mean, yeah, I have been qualified now for, I want to say 5 years. Doesn't look like it, does it? I still look really young, don't I? Anyway, moving swiftly on. So I'm kind of getting the vibe here that you just wanted in for a little checkup. Just a little chin wag to see the doctor. Have a little assessment, you know, a little touch of the face and touch of the ears and all that jazz. I mean, of course, there may be something wrong with you. That is true. But it's okay if you're just looking for that bit of personal attention. Well, in which case, I may, or can, not may, I can certainly perform a lot of medical procedures on you today. Nothing invasive, all very relaxing. Yeah, we can test your eyes, your cranial nerves, so we can have a good look in these lovely fine ears of yours. We can test some of your reflexes. I can even stick plasters on you. Don't knock it till you try it. A lot of people love a bit of plasters being applied to them. So, what'd you say? Great. Okay. Well, for my records, we'll call you John and Jane Doe. Okay. We'll just make up a fake profile for you. Then I can just be like, oh, they were very unwell. We needed all of the assessments done for them. I'll tell my receptionist to cancel my next few appointments. It's not a problem. Anyway, I do need your date of birth though. Just an accurate one would be good. Yeah. Alright. I don't really like writing stuff down, if I'm honest with you. Okay, I'm just thinking if there's anything else I need to know right now. I don't really think there is. Right, I'll have a look in my medical box to see what we can pull out. In the meantime, do have a nice look at my lovely posters. I thought this one was particularly fetching. Peachy. Right. Okay. We ought to put some gloves on though. You know, germs and all that. I can assure you I am germ free, but can't say the same about you. We don't know where your hands have been. terrible at getting these things on. There we are. Well, why don't we do a little bit of a thorough examination? I'm just going to have a good look from your head to your toe. Have a little feel. Completely normal. I'm not going to be like weird about it. I'm just going to make sure that there's no, lumps and bumps and all that jazz, okay? So I'm going to come up close to you. Do you mind? Great. Okay. So, excuse me for the creaky floor. So we're going to just start up here. Did it take you long to travel here today? No. Gosh, that was such a boring question, wasn't it? I do find myself sometimes becoming a bit boring like normal doctors. And then I remind myself that I am certainly no normal doctor. I am quite unique. Oh my goodness, what is all that racket? I'm pretty sure it is the doctor next door. I like silence. Or rock music. I will sometimes put rock music on. Okay. Apologies about that. Okay, so no lumps up there. Let's have a look in here. I'm just gonna, oh yeah, top. Okay. Right. Oh, wait till I tell you about my last patient. You're going to love it. Well, patient confidentiality and all, but I trust that you won't tell anyone. Oh, what a person. Basically, I mean, it wasn't intentional. It wasn't intentional, I promise you. But I was performing a cervical screening assessment, as you do. And we had some issues trying to place the speculum. You see, it's like the clamp that goes in it. So, anyway, we had a couple of issues. I had to get some other nurses in to come and help. And, well, unfortunately, I didn't realise, while discussing this poor lady's situation, we had left the intercom on to the receptionist, and the entire waiting room could hear our conversation and the difficulties that we were having putting the speculum in, and some of the things that poor woman said. Yes, we had to usher her out the back door. She couldn't face going through the reception lobby. It was very, very funny. I quite enjoyed it, It was pretty entertaining for me, I have to say. Oh, I have so many stories I can tell you. The list goes on and on and on. And obviously, you must know if we find anything odd, it will be discussed about in the staff room. I mean, surely you would as well. Exactly. Right, okay. I am thinking. Okay, I am pretty confident that the lumps and bumps are very much kept to a minimum. Yep, there's nothing strange. I mean, you have a couple of molds here. They look okay to me, if I'm honest. Yeah, totally fine. I'm going to do a really good ear inspection / cleaning on you today, I think. Yeah, there's a little bit of wax in there that we're going to sort. Okay. Just thinking what first. Right, out. I know what. Let's see if you're colourblind. I mean, I don't think that you are, but little look. It could be funny if you are colourblind. Alrighty. Tell me. Oh, this is a hard one. Okay. This one here. What number is in that? You must be able to see a number. Come on. Come on. Yeah, I can just about. You could well and truly be colourblind. Come on. It's the number 34. Dear, oh dear. I bet you found this one dead easy though. 41. Okay. Oh, I've got another hard one. I love the hard ones. This, can you see a number? If I go further back. Not that one. This one. You're right, it says 63. Okay, maybe you're not colourblind after all. I mean, this is so easy. Yep, this one. I like the hard ones. This one's a little hard, but it's not as hard as the others. Yeah. Oh, okay, what letter is this? Yeah. What the actual F is this? What is this? To me it just looks like two blobs. Maybe this to me, this here. The shape looks like an alien saucer. A yellow alien saucer on the green background. It's awfully strange. Yeah. I don't know who wrote this book, but they're not very clever. And like this is a love heart, but it's a pretty rubbish one. And this, yeah, which also stands for I'm going to send you to sleep if I keep doing the colour book, because it's a little bit boring. Okay. Well, it's only boring because you can see the colours perfectly. Otherwise it would be mildly entertaining. Right. We're going to continue with the eyes. I'm going to have a good look into your eyes. I've got some really fun little pocket Snellen charts that we can do as well. I found it. My pink one. This is a stethoscope. Of course, we'll be listening to your heart a little bit later on in the session and doing your blood pressure as well. We've got lots to get through. Okay, now look at me. Okay, right. I'm just going to. There we go. Right. So. Looking at you. Yeah, okay. Right, let's just cover this eye and I'm just gonna have a good look in here. I swear you've got a scratch on your eyeball. Yeah. Do you know what you did there? Anyway, can you look up for me? And down. To your left. And to your right. And up. And down. And to your left. And to your right. And up again. And down. To the left. To the right. And up and down. To the left. To the right. We can do a little bit of a song on that, can't we? Right, other eye, let's close this. Right, look up for me. Look to the left and to the right. Okay, up and down. To the left sensation. Okay, so what that means is you need to follow my fingers. I need to follow them all the way into the face, and down into the face, and out, and it goes on. Okay, right, ready? In we go. And out. And there we go. And out again. And in we go. And out again. Cute. Let's do the other one. And out. Mm-hmm. In we go. And out. And in we go. And out again. And in we go. And out. Excellent. Right, now let's do the peripheral test. It's a good test. You'll like the peripheral test. You basically do all this and you have to tell me when you can see my finger. Okay. Let's go. So, yep. Super fast, like how quickly can you like nod your head when I do this? Okay, ready? Okay, I guess that means we're no longer playing that game. What a shame, it was good fun. Okay, let's do your Snellen test. Oh my goodness. Have you seen how cute this is? This is the cutest little baby Snellen chart I think I have ever seen. It's so cute. Okay, so are you ready? I'm gonna hold it here. Try not to get any light shining on it or in focus. What is all this lightness? There we go. Okay. Yep. Yep. Excellent. Great. Okay. Yeah. Amazing. Well, you've got to get the last one. The 2020 line. Come on, you can do it. Oh, last letter, try again. What's that last letter? Okay, I'll give you. You have 2020 vision. So, what that means is that you've got really good eyes, and you probably already knew that you've got very good eyesight. Yeah, but you're just happy for me to do it anyway. Thought so. Did you find it relaxing? Good. Good, good, good. Okay. I just spotted this. Okay. This could actually be fun. You might like this. So, it's a reflex. Like, I'm gonna hit this on your knee. And we're gonna see, like, just below the knee. And your leg should swing like this, okay? So I'm gonna hit it. And I want your leg to swing, but don't move your leg. It's got to be involuntary. So we can see if your legs are working. So I'm going to start off with your left knee, okay? That didn't actually do anything. Right, again. Let's try another one. Yeah, that did it, okay. Maybe I need to go further. Like that. Yes, that's it. I kill when I do it to myself as well. It goes quite almost a bit like having a funny bone in your knee. But it just means that your reflexes are all good. Which is kind of part of cranial nerve examination. Because when I do the cranial nerve examination with you, I'm just going to do it a bit scattered. We're not going to go through each cranial nerve exam because I've just done your eye test, which is part of it, and I've just done your reflexes, which is part of it. So, you know. Anyway, moving on. I've just seen this as well. Let's do your oxygen levels, and we will do your heart rate. I'll listen to your lungs, and then we'll do your blood pressure. I think that could be really cool. Okay, right, just stick your finger in this little thing. Yeah, like that. Okay. It's this finger out. Mate, I don't think you've got a heart rate because it doesn't recognise that you've got a finger in there. Mate, what are you doing? Oh, there we go. Okay. And your SpO2, 98%. It's pretty decent. Okay. Oh, there we go. It's like calculator. I think it's good. Right, look at this. I have such a vintage blood pressure equipment. So now you get the blood pressure machines and it's all, automatic and all that jazz. Well, I have the old-fashioned blood pressure monitor that we need to look at the gauge. We need to listen to it and all that. It's good fun. I keep saying fun, but it really is fun. You're just gonna enjoy this so much. Right. Let me just listen to your heart. Let's see if it's stopped a beat. I bet you it's quickened. Okay. Just breathe normally. Okay, I'm just gonna place this on you. Okay, breathe in and out. Now I'm gonna use my Fitbit to measure this, okay? Alright, sounds good to me. Okay, I'm just gonna listen to your lungs. So just gonna have even closer. Okay, then just breathe in and out. And breathe in and out. And breathe in and out. That's it. Very, very good. Very, very good. That's it. Okay. I think your lungs sound like they're breathing, so I think that's good enough for me today. Right. I am going to move swiftly on to your blood pressure. Alright. We'll go with, is that your non-dominant arm, your left? Right, we'll use this one. me light. I'm gonna open this, okay? These blasted things out of my ears. Honestly, they're just not comfortable. Don't know why any doctor uses them, to be honest. I mean, when we really need to hear somebody's heart, usually they're already, hooked up to a heart monitor anyway. So, I think people just do this to be like, hey, I'm a doctor. Look at me. I'm a doctor. Because it's stethoscope. Classic. Right. Moving on. Okay. I think we ought to give you now a little bit of a hearing test. What do you think? Me too. Because it can be incredibly embarrassing if somebody comes in to kiss you on the neck and all they can see is earwax. So gross. Okay, let me have a look. Right, this. Yes. Alright. I'm going to have a good look in here. I'm going to start with your left ear. Just pull your hair out of the way. To get access to that ear. There we are. Okay. Just stick that in there. Okay. Interesting. I think we may have to clean that. Okay. Alright, okay, let's just have a look at the other one. Over here. This is what I expected. It is what I expected, and I've literally just lost my otoscope nozzle in your ear. There it is. It's in your hair. Well, I bet you get some new ones of these. Right, interesting. All it means is we're going to need to clean your ears, but let's do a little test first. I have this. This is my little tuning fork. And we'll do some tests first. I'm going to do this and you're going to let me know when you can no longer hear it. Let's just say. And then we're going to do the test where I whisper in your ears, you tell me what I've said. And then we're going to clean your ears. Okay, clean them. And then we're going to do the test again and see if it's improved. And I reckon it will have. Alright, does that sound good? Great, this is like a lot of fun. This is my favourite part to do. Okay, so. You were fine at that. You can obviously hear quite well, but it's all good, it's all good. Okay, I'm going to do the test, okay? So I'm going to whisper in one ear. And then I'm going to make a noise in the other, and you need to tell me what I said, okay? Santa. Ball. Shoot. Dogs. Boaty and boat face. Old crusties. Coca-Cola. Wheat. Cake. Sexy. Hot stuff. Chips. Oh, very good. Very good. Alright, we're going to give these ears a good clean. My apologies, my medical box is rather full. Right, what we're going to do is put this in your ears, and then it will break up your wax, and then I can scoot out. Delightful. Yours will be easier because you should have to see some of these old, or crusties is what I call them. Crusties. What I have to do with their ears is rather not so nice, but this is satisfying. Makes me think like I'm Dr. Pimple Popper, which, by the way, I hope to be one day. Oh, that's far too much in there. We're cooking this thing. Okay. That'll do. Just gonna put a little bit there. I'm not here just now. Actually, I'll do your other one. No, I'll do you now. Just quickly. So it breaks up nicely before I do anything. Okay. Look at that. This little dropper thing is going to break. Ew. Alright. Yes, sometimes I get some old crusties, and I think they just come in for their chat, you know. I've got one lady, she comes in, she says, "Ooh, I've got a tingling sensation down there, doctor. I don't know what to do." And really, I think she just wants some action. But I've got a couple of old singles. I should actually do kind of crusty datings club is what I should call it. Crusty datings club, where they'll come and they meet other oldies and they date and all that jazz. Right. Do you not think that's a great idea? I think it's a great idea. I could be Dr. Matchmaker. Well, I would do it for the young ones, but I can't because they don't come to the doctor, do they? Especially not. You're notoriously, like, you're nice, sort of like, maybe like a 30 to 50-year-old businessman. They don't come to the doctors ever. So, they think there's nothing wrong with them. They think they're invincible. So, we need some of them if we wanted a proper dating agency. And then the young ones, they just come to me with all their STIs. And you don't want to put them on dates because you don't want to be passing that around. So, I'm stuck with the oldies. age of 60, so we could be seeing some old babies yet. Right. Does that feel your ear? Your cartilage is quite thick up here. Have you ever played rugby? Or any sort of sport? It's a contact sport. Okay. We'll need to be checking your head next for lice, by the way. I just saw a couple of little white dandruff flakes, and you never know. It could be lice that catch you. Right, let me have a look at this here. Oh, this one's been broken up quite nicely. I mean, I would say you do have a good ear. What makes a sexy ear? I do not know. I guess not too sticky out. It needs to be appropriate, but you don't want it flat, completely flat. I can't say it because it's just look in here. You want a nice lobe. I do love a good lobe. Preferably attached. I don't want anything too droopy. I guess that's what makes a sexy ear. What makes a sexy ear for you? I see. How interesting. Alrighty. How are you feeling? Great, great, great. I don't even know where to put my phone. I feel like it's buzzing. Must have dropped it, so I'll find it later. That's probably my date for the night, you know. All that jazz. I think this side could be a bit more blue. This here. A bit more blue. Yes! Oh my goodness. Blue, blue, blue. I'm loving my new lights. I wanted to make it a little bit like a disco in here, you know. Like I said earlier. Anywho, let us move swiftly on to your head check. We need to do some lice check. It doesn't matter that you're not school age anymore. You could still pick up lice anywhere. Or fleas. Did you have a dog or a cat? You know, you've got to be careful about this. So, I'm going to start here and make my way down around with him. What's that? Oh, it's a bit of dandruff. Okay. Need to use my head and shoulders. No, I can't prescribe you shampoo. I mean, I could, but I'm not going to because I'm just lazy. Lazy. Just use head and shoulders and it'll be fixed. Okay. It's like the same, like people who need paracetamol and ibuprofen prescribed. You can literally buy it for like 17 pence in Boots. They're not needed prescribed. But everybody wants a freebie, don't they? We all want a freebie. so we're doing this like quite restrictive and all that. What is that? And my friend, oh, it's so funny. Oh, one of my good friends, she works in accident and emergency. Oh, I studied with her, bless her. She just has the funniest patients. We love to talk about patients over a bottle of wine. It's just so funny. Oh, the amount of people that come in that have stuck things up themselves that they shouldn't have is hilarious. She recently had an old man that put a toothbrush up his backside, and he claimed he didn't know how it got there. So that was interesting, especially when the wife had to come. He had to get operated to get that out. But he had no idea. He must have just been walking, and the toilet brush must have just gone zoomed right up. But he had no idea. Maybe he said he may have lapsed in memory and fallen out of the shower onto the toothbrush. Because that is just what happens. That is what happens. I mean, I hope you're not one of those people that has done something like that. Indeed. There's so many cases of this, people coming in with all sorts. Imagine realising you'd gone and lost that up there, and how mortified you would be knowing that you'd come into hospital. At the moment I'm seeing no lice, but we can't be too complacent. We may find some more lice. That bloody doctor is walking around again. It's so loud. It's like they've got brakes on their feet. Also, please do not go home and try that with the toilet brush. Just want to get that out there. Some people may. Please don't do that. No, thank you. could do with getting your hair cut. Just a little bit. Yes. I mean, I'm no barber. I could definitely cut your hair, but that's another time. Right. Okay. Quick temperature check. Just got a happy face. That's fine. Now let me have a look at your teeth. No, I'm not a dentist, but I've always liked the idea of being a dentist, so I keep with me a little dental kit in case I have a patient that would like me to look at their teeth, and you've got no choice. So let's do this, okay? Look at these tools. Dentists have such fantastic tools. The damage you could do to the teeth with these bad boys. Love it. Okay. Open wide, my friend. Yeah, you've got like a bit of plaque. It's just so much fun to get out. There's a hair there as well. But can you stop eating hairs, please? Finally, before you go, we need to make sure that the receptionist sees you go out in lots of bandages so that she thinks that there was something really wrong with you, which is why you need to do an hour with me. So we're going to do plaster try-ons, which is so fun, okay? So fun. Put it on. First aid kit, so fabulous. stop. Oh my goodness. What is this? Oh my goodness. This is like actual heaven. Whoa. What's this? Like, I think it's obviously the residue, but stick it. The cleaner will cut that. Right. Oh my goodness, look at these little things. Right, let's pretend that we did a mole removal. We'll stick this on the side of your face here. Okay. Stick in that. And we'll do another mole removal on this side of your face. Or like just under your neck actually. Just do it like this. Oh, so fun. Okay. Like that. Right. Then, oh, I've got the little sutures. Right, let's pretend that you had like a split head and that you didn't go to A&E because you didn't think it was bad enough, so I just did the job for you. We'll just pretend you got into the wars. No, she won't recognise you when you go back. It's all good. And, right, let's put this one across here. Like that, and then we'll put a second one. So it's like little stitches. It'd be so cute. Like so. Okay. Across this way. Yeah. Got one more here. We'll put this like, oh, we'll put this on your chin. Be so good. Okay. If I can even get it open. I'm so bad at getting these things open. Right, right under there, like that. Lovely to play again with this. Oh, the cleaner shook at it. Well. That looks quite good. So you've basically got mole removal there, a split head there, and a split chin. So I'm just going to write up your notes. So we have had such John and Jane Doe. John Jane Doe, that's it. With a double barrel name. John Jane Doe. Okay. You were born on the 11th of May. Okay. Injuries sufficient with story of falling over while being chased by a parrot. Yeah, that's better. I didn't want to use dogs because I love dogs and I didn't want people to think dogs are aggressive. But we can have an aggressive parrot in this story. Parrot flew off. Okay. Stitches to head and chin. Full body examination. Check for cranial nerves and concussion. Mole removal ×2 due to recent changes in colour. John Jane Doe will be back in probably a few weeks or a month. I'll say 4 weeks for a pleasure to make your acquaintance, and I'm sure I will see you again soon. It was super fun. It gave me an easy hour. It was just fun. I like playing with my medical toys. Anyhow, I'll see you soon. Just see your way out. Just say hi to the receptionist. You can give her that piece of paper, and